tape them up or something. We do, I've had tape race before, it's, yeah. Now, Jolene's got lots of ostomies, so pretend like you don't see these. But, any,
When I see them ostomies, I can tell them.
okay, before you do anything, before you do anything, you wanna make sure that she's clean, right? And when you get to pre-op case management, you'll learn how they do a shower. She's probably been shaved and all that good stuff before, where's my food? She's been shaved and all that's been done before, but if she were a trauma patient or something, and she had glass on her, or she had oil from a road, from a car wreck or something, then I would make sure that it's clean, because you can't sterilize anything unless it's clean. So we're gonna pretend like all that's been done. All I've done is just remove your ostomy bag, and pretend like you don't see these ostomies, okay? Pretend like she's just a nice, flat belly. Then look at your prep tray. Shoot, I didn't get one step further, I forgot to get that. They're in the, in there too, like in the freaking supplies. But read your kit and see what's in here. This comes with the prep solution, betadine prep solution. I'm gonna open the dust cover. Like this. Pull it out. And pretend like I have a kick bucket right here, okay? It's easiest if you set it up so that you can go from sterile, prep, drop it. Sterile, prep, drop it. If you set it up over here, then you're gonna be like sterile, prep, come back, drop it. To me, it's easier if you just keep it in a one-way flow. So I'm gonna open my prep kit, furthest away from me. Does somebody want to come and record this like over it or? Okay, as long as you can see. I'm gonna go furthest away, closest to me, or side to side. Okay? Now, got my prep kit in there. I'm gonna reach in here and grab my gloves.
Don your gloves using complete glove technique.
Okay? Make sure that you're paying attention to how to do open glove technique. Grab the unsterile part, come back, put my hand in here, push my fingers down. If these fingers bounce up here, that's contaminated. These don't work too good for me because I got big hands. Okay, so I've got that on. Now I'm gonna grab the inside of the glove, right here. Same thing, I got a little pocket. Push this on and pull this up. Okay, are my hands sterile? And now I'm gonna set up my tray.
Separate contents.
Okay, these towels are called the drip towels, and these are the absorbent towels. Okay. Now, I take, the one with the brown is the scrub or the soap, and the one with the green is the solution. And the scrub, the purpose of the scrub is to mechanically wash the skin. The purpose of the solution is to cover the skin. So inside your prep tray, you have 2 Q-tips, scrub, paint, 6 wing sponges, and 3 paint sponges. This is a paint sponge. This is a Q-tip. And these are wing sponges. And wing sponges just means that you can hold it like a wing. Okay? Put your wing sponges, I organize it so that I can pour this over my wing sponges, pour the soap over my wing sponges, and then pour the paint over my paint sponges. Okay? Then I'm gonna take my drip towels and open it up. Now, what students want to do is let it touch them, like it touches all up on their arms. Okay, you do not have a gown on for this. You may have a scrub jacket on, but you don't have a gown on for it. But do you teach sunny side up, shiny side down, anything like that? I don't know the difference. I mean, I think the shiny side is the stuff runs off the shiny side and absorbs in the dull side. So I guess you'd put the dull side up. I don't care what you do. Cut my hands and tuck it in here like this. Now you can't really see what I'm doing, but do you see how I'm not touching her body? Okay, my hands are still on the inside of this towel. Same thing, open it up, make my cup, and then walk around and tuck it up under here. Where you'll mess up is if you touch your sterile gloves to anything unsterile. Her body, the gown, the drapes. Okay, then I'm gonna come back around here. Now I'm gonna start my prep. See, I got an imaginary kick bucket right here. First thing I'm gonna do is clean out the belly button. Now, this is not part of the sterile prep, okay? I mean, it is part of the sterile prep, but it's not, you gotta do this first, but the belly button is not really sterile, naval, umbilicus. So hold your Q-tip up here, protecting your arms, your gloves, and clean the belly button, and then get rid of it. In my kick bucket, don't drop your hand. Clean the belly button. Sometimes you have to ask for more Q-tips. Sometimes you have to get a sponge, and but make sure there's nothing funky in there. Then get rid of it. Don't drop your hands.
What solution's on there?
Betadine, soap. The soap. And then just don't drop your hand. Let it fall in your kick bucket. Then take your wing sponge, get some soap on it, hold it like a wing, start at your incision site. She's having a exploratory laparotomy, so she's having a midline incision. Going in little circles, okay? I'm gonna scrub little circles. And then I'm working my way out. Going in little circles, out. Just working my way around and up and down. Now I can't really go any further at the top, right? I'm gonna hit her down. So I'm just gonna kind of go back like this, but I'm not going back up, I'm going down. Then I'm gonna get rid of it. Same thing. This should take 3 to 5 minutes, okay? Same thing, little circles. Around, what we don't want to see is you touching this. If you touch this, that's a don't pass. If you touch this, that's a don't pass. If you retrace, that's a don't pass. So I'm not going to sit here and do this to you 6 times with all 6 of these wing sponges. I'm not going to make you do it in the checkoff either. Once you demonstrate you know the technique, I'm not going to make you do that. I just want to know that you know, don't retrace, don't touch the gown. Got it? Then drop my hand. And it should take 3 to 5 minutes, so you could use 6 sponges. Now this thing is pretty big. What you don't want to do here is drag, okay? But you open this up, actually it's not as big as I thought it was. You open it up and you lay it down. Got my hands cuffed right here.
She's real soapy on her tummy right now.
Yes. You lay it down and you pat. Now, I'm not doing a good job because that's touching my arm, but you pat the soap and you picking it up, okay? Is this sterile? Is that sterile? This is dangerous. Is that sterile? I can't see it.
It's not touching anything but her.
Okay. Because I can't see it, I don't know. So I'm gonna pick it up and peel it off, okay? What you don't wanna do is drag it off. See the difference in peeling and dragging? So peel it off and get rid of it. And if you have to do it again until you get all that soap off. Then you're gonna take your paint stick, get some paint on it, start at the belly button, the incision site, and go around and around. And the whole time I'm trying to control my solution so that it doesn't run. You don't want it to run and pull up under them. Okay? So if you need to wring your sponge out, you can. If I'm not retracing and I'm not touching her gown, and then get rid of that. And the same thing, round, 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 round.
That's with the paint solution.
That's with the paint solution. Then, when I'm finished, I'm going to take this away. Then I'm going to come around here, I'm going to take this away. I'm going to take this away. I'm going to put this here. I'm going to gather all this up. I'm going to put it in my kick bucket. And your kick bucket has a double liner in it. For Greenville Tech Memorial purposes, your kick bucket has a double liner in it. So take that first liner out of the kick bucket and just tie it all up and reprocess your stuff. In the real world, all that just goes in the trash can. Okay? Any questions about prepping?
So we're gonna have to do it on that mannequin.
Yes.